they say, pink in the morning. Sailors take warning. Sorry for my voice right there. Good morning, everybody. It's about 7:30 on Wednesday, the 27th of March. And like I said, it's pink sunrise, so we are definitely getting rain today. It's already in the forecast and expected. I am headed to lecture. We are doing musculoskeletal lecture and genitourinary, possibly male reproductive. Those are all the things that we had to cover this week. I did finish all of the sure path yesterday. I did the PME on reproductive and genitourinary last weekend, not this past weekend, but the weekend before, I believe, or last week sometime. And the other thing that is going on, what was I doing yesterday? Oh, we had an hour and 20-minute lecture on the musculoskeletal, mostly like fracture stuff, and like braces and splints and casts and stuff. So there was a lecture on that I watched, a whole bunch of PowerPoints, some from our Canvas course and some from SurePath. And what else? I'm trying to think of anything else. I went through the videos that were up on the Canvas course relating to genitourinary. I don't know what else. Oh, I did organize my binder this morning because I had a whole bunch of just like loose papers from the pharmacologies and all the SurePath and all the PowerPoints. So I went and put those in. I haven't labeled them yet though, so they're gonna be hard to find. The other thing I wanted to say is we had a adaptive SurePath quiz on MS, or maybe it was musculoskeletal. Pretty sure it's musculoskeletal. So I did that. That wasn't due until like April 1st, I think. Hello? That was weird. Hopefully the video before this worked. But yeah, so we'd have our last quiz and lecture today. So it ended up being 4. And we've had 3. I've had hundreds on 2 of them and a 70 on the others. So the 70 right now is to be dropped, pending today's. And I can't think of what else. So I know next Monday we actually have our last sim. Oh my gosh, this like stuff just comes up so fast. I feel like we were just there this week. And then, oh my gosh, we only have 4 weeks left of school, which sounds great. But it is scary because I know how much is coming up. So I've been trying to like compartmentalize things because otherwise I'll get stressed out. So I try to like take them one at a time and deal with them individually rather than like a heap of things. I don't know if that is a good method or not, but I don't want to be overwhelmed. So we're almost to the end. And then did I mention that I got a job overnights, full time? I'm supposed to start when the semester's over, so thank goodness on that, so I can finish out my semester. Yeah, I can't think of anything else. So we have our clinical on Friday. I need to work on our study guide because I think our exam is next week, actually. Oh, there's another thing. So let me just pretend that's not happening. Out of my head. Today I got to do it today. Okay. Yeah, and it's going to be a long day. I also have to meet with the advisor to talk about my schedule, make sure all of my prerequisites are taken care of for my degree, which I'll be getting in a year. So just 2 more semesters after this is done. So yeah, there's a lot going on. But I'm going to go ahead and get to school, everybody, and I hope you guys have a great day. Bye. Good morning, everybody. It is just before 6 o'clock, Friday, the 29th of March. March is already over. That is crazy. I'm headed to clinical, of course. Lecture. So, they did give us a lecture on fractures, mostly. And then we did kind of like a, she called it an escape room, but it was more like, kind of like scavenger hunt, because you had to go, well, I mean, I guess you call it an escape room because you kind of had to solve questions about fractures and stuff. And I think there was other questions on there too, but anyway, there was that, and then we had to make a concept map of a genitourinary or musculoskeletal problem. And the first team we finished ended up getting a bag of Easter candy. So we did not finish in time. Our team got very confused and walked all over campus looking for the QR codes. Wow, the moon is really bright. And then we had our quiz. So the thing is, when we were going over the quiz after everyone had turned it in, going over the answers, she initially said that one of the questions, technically both answers were correct, and she was going to review it. But then when I got my quiz score on Canvas, she had not given credit for the one that she said had 2 correct answers. So I got a 90 out of 100. So I finish out my quizzes this semester with 200s and a 90, because one of our quizzes, of course, ended up being disqualified, and of course I had gotten 100 on that. And then the first quiz we took, I did not do very well on. So yeah, so there's the quizzes. They're only worth 5% of our overall grade, so yeah. Exam is next Wednesday. I did start yesterday making a study guide. I got through diabetes pretty much. I want to fill in a few more things, but got through that, and still have like 5 subjects to go or something ridiculous. Easter is on Sunday, so tomorrow I don't have anything planned, and I am going to be hopefully finishing my study guide, because just like last exam, we have a simulation the Monday before our exam. So we lose a day of studying. So yeah, again, I think I just have like the same reaction for everything that disappoints me a little bit now this morning. I mean, it is very early. My mouth is also very dry, and I did not sleep well. I did take my like nighttime medicine that is supposed to like relieve anxiety as like a side effect, but it's meant to just knock me out, honestly. It's an antihistamine, but since I have a problem with being able to fall asleep, I take that, and it does put you to sleep, but I also wake up a lot. And I don't necessarily think it's the medicine, because I think I just do that already because I'm worried I'm going to be late. So I wake up all night worried that my alarm's not going to go off. And right now my alarm system is all messed up too. So I don't know what happened to like I'm not using like my phone alarm. I use an app, and all of a sudden it just stopped working last week. So thank goodness I wasn't supposed to go somewhere. It actually, it stopped working when I was trying to set it. So I knew right away that it wasn't going to be okay. And then I had like the hardest time trying to find another app to use to wake me up. And like the one on my phone is kind of ridiculous because like it makes it like a no disturb zone. So like my watch won't, like if I wake up in the middle of the night and I want to know what time it is, it's a pain in the butt to look at the time on my watch. It's a pain in the butt to try to get my phone to show me the time because it's like trying to get you to go to sleep. But that's how people get late for school and work. And I'm angry about this. But yeah, I ended up waking up like 15 minutes before my alarm. So I still don't know if it works or not because I haven't let it work. Yeah, so today, clinical, I know it's going to be super long day. I'm not terribly excited about it. I did bring a lot of stuff that I could use to study. Hopefully I'll get the chance. Yeah, so tomorrow the goal is really, honestly, I got to get that study guide done. I have to. Because there's just no other time. They don't give us a lot of additional time. So I got to get that done, and then I got to start studying it. And I am doing it in different colored pens, so hopefully that'll help retain information if I can like associate the color with the material. We'll see. I really have this like yucky taste in my mouth, and I just brushed my teeth, and I didn't even eat. I had coffee and I brushed my teeth, and it just tastes like metallic. I hope that's not like a bad sign. But anyway, I'm gonna head out to the hospital and I'll catch you guys later. Bye. Hey everyone, I just wanted to do a quick finish to week 11 clinical, because I don't think I finished up that video. So it was a super long day. We were there to the very end, dinner time. It was fine. I was supposed to be in the ER, but the LPN clinical group beat us there. They also beat us to ICU. So there was like 7 of us on the Med Surg floor, and we were 2 to a nurse. So thankfully the nurses handled it really well, and we still got to do stuff. I did get to give medications, so that was really neat. I got to prime and spike an IV bag for antibiotics. Got to give some oral meds to 2 different patients. Did a lot of vital checks, and that's Med Surg. So that's pretty much all there is to it. We started off the day with a lot of like excited, happy people, like ready to go home, because Friday is usually discharge day. But as the day wore on, a lot of those people had issues that were still unresolved and ended up not being able to go home. So their moods kind of soured. So that was kind of a downer to the end of the day. But all in all, it was fine. I am actually going to be headed out onto the main road now. So I'm going to get going. I got to get to my sim today. And I will catch up with you guys later. Bye.